Sexual and reproductive health and rights are an essential part of universal health coverage, and countries moving towards UHC need to consider how the SRHR needs of their population are met throughout life force, from infants and childhood, through adolescence, into adulthood and old age. To effectively meet the SRHR needs of people, a comprehensive approach to SRHR is required. And on this account, Lusaka advocates together with ARASA held a 2-day workshop training for youth on SRHR and how young people can influence the implementation of the universal health coverage. Speaking shortly after the workshop, one of the participants, Harris Montala, notes the need for governments to involve all stakeholders, especially the youths, in the implementation of sexual and reproductive health and rights.
Namwila Foundation and Zuka Cholinga, a community-based organization. So practically the workshop seeks to give us some of the international treaties or documentation or protocols that we have on health in terms of how to have universal health coverage, and also trying to underpin what are some of those things that Zambia has ratified and domesticated, and also looking at how can we influence its implementation. So the core part of this workshop is looking at sexual reproductive and health rights, which is short words SRHR. And basically, how has it been for Zambia? Does it meet or does it link with the universal health coverage? And where are we lacking as a country? And how can we as activists or young people influence its implementation? So the first day yesterday, we tried to look at the fundamentals of universal coverage in relation to human rights, because we know that human rights doesn't have a face. You have the rights because you are human. And my word also goes to government and its implementing partners that they should be looking forward to implement inclusive health services without discriminating anyone at any sector.
Chawembe, also a participant, notes that civil society organizations and communities has an important role to play in achieving universal health coverage.
We as a civil society and community have a big role to play in achieving effective universal health coverage by advocating, researching, and helping in service delivery. We need to be at the decision-making table at every stage of the designing, implementing, and monitoring of the UHC, and hold governments accountable, especially when it comes to the most vulnerable people in the societies.
However, the 2023 United Nations High-Level Meeting on Universal Health Coverage provides countries and all stakeholders an opportunity to stimulate progress toward delivering health for all. An action-oriented outcome focusing on building resilient and equitable health systems is key to provide the basis for implementation and accountability, building on the 2019 political declaration. Margaret Chota, Movie TV News in Lusaka.